Hi, we're from the University of Ottawa. Today we're going to show you a rehab program for a shoulder injury, a supraspinatus tendonitis that James here has suffered while playing volleyball, off-season training, doing a lot of repetitive overhand motion while serving. So today we're just going to show him a few exercises that James can do at home to try and gain back some of the stability, strength, and range of motion in the joint. Alright, so the first exercise that we're going to do here with James is a progressive exercise that is going to help strengthen the shoulder and stabilize the shoulder joint, the scapula itself. So the first thing we do is we're going to secure the band in a door high enough up. The reason we start up high enough is that the progression of the exercise is to bring it down, which we will show you as we go. The first thing James is going to do is grab onto the band with a bit of tension in the band. Now he wants to keep his arm straight, his elbow straight as well, and he's going to bring back the band slowly and squeeze his scapula as if it is coming down and in towards his midline. He's going to hold that for about 5 seconds and then slowly bring it back up as well. So this is a slow exercise, and he's going to do that 3 sets of 10. So again, we'll show James is bringing it back, bringing the scapula in towards his midline. He wants to feel as though he's squeezing that scapula in towards his body, and then slowly release. So there's no bending in the arm, it's just kind of a slow progression towards the back. Alright, so with this exercise there's progressions that we can bring in. The first thing that we can bring in is different heights. Now of course with an injury and having limited range of motion, we want to start up high enough because it makes it a little easier for the shoulder. As we go along, we can bring down the height of the band, and this will challenge the patient a little more. So we bring it down to about a midline there, and we will do the same thing, keeping the arm straight and bringing it back, scapula in towards. And same thing with that, we can progress, and our goal is to get down to equal line and have it at an equal body level. Now the next progression for these exercises is to bring in different tensions in the band. Now green band is the next step up from red, which is the lightest, and then a blue band. So these will increase the load as we go and make it more challenging for the patient, and will help strengthen the shoulder as we go and bring in some more stability of the shoulder joint. So for this exercise, what we're going to do is we're going to work the external rotation. Now this exercise is going to be fastened on the door. And again at about shoulder height for the patient. Wrap that around his wrist. Now we want to make sure that the elbow is nice, locked in, that the shoulders are back and flat on the back. Shoulder again staying in on the side. And then we are going to externally rotate. Now for James, he's a little bit limited on the range of motion. So he's going to go out as far as he can until the point of pain and no further, and then slowly bring himself back in. So what we're going to try and do is come out, hold for about 5 seconds, and then slowly back in about a count of 5. So James, 1, 2, 3, 4, 5, hold, and slowly back in. 5. Perfect. And we want to make sure that we're keeping that slow and stable, that the shoulders are flat against the back, and that the elbow is nicely on the side. And we'll do that one more time, James. Slowly out, hold at the end of the range. Again, no further than pain, and then back in. Perfect. Very good. Now again with this exercise, we're going to do about 3 sets of 10 repetitions. We're going to hold at the end of the range and or at the end of point of pain for about 5-10 seconds, and then slowly bring it in. Now with this exercise, again, we can bring in different band resistances. Now with this one, we want to progress through the band resistances before progressing on to a different position. So we would bring in the different bands, the green first and the blue, and progress those in as we feel comfortable or as strength is needed. Once we have mastered those 3 different band intensities, we will change up the position of the exercise. So what James is going to do is going to grab it with both hands, wrap around the wrist there. We're going to have the palms facing in, shoulders again locked to the side, elbows to the side, shoulders back, and then we're going to do the same thing with both and externally rotate. Now this one is a little tougher, and we're not isolating just one shoulder, so we want to make sure that posture is correct. So with this exercise, we will go back to the original band, the red band, and progress up the band intensities as needed. We don't want to jump right into a higher band, so we want to make sure that we can master this technique with the lower band and then slowly progress through it. Alright, so the next exercise that we're doing with James are the serratus punches. These exercises are done to help strengthen the serratus anterior muscles, which will help stabilize the shoulder joint. So what we're doing, similar to the first exercise, we're going to fasten the band into the door, but instead of going up high, we're going to bring the band down low. This helps, as we progress, isolate the muscle and work different ranges of motion. Alright, so James is going to grab the band here. He's going to make sure that it's fastened properly, and alright, he's going to do a punch out. So we're going to bring the arm out straight and then slow punch. Now James has pretty good range of motion on this exercise, so therefore we're going to try and round the shoulder out and go out as far as we can, hold a few seconds, and then slowly back in until we feel the shoulder back flattened and stable. And then same thing, we're going to do that again. Slow, 5 seconds, and back in. Now this exercise, again, we're going to do about 10 reps for 3 sets. And you want to hold it for about 5 seconds at the end of the range and then slowly back in. You can let go there, James. Perfect, well done. So with this exercise, again, what we can do is progress the height of the band. Of course, trying to get back to mid-height or shoulder height, so that when we are doing the serratus punches, we're at about shoulder height. So that is the progression with the bands that we are trying to do. That's good. Once again, another progression that we can do to increase the load and help strengthen the shoulder is change the bands. Now again, the green is a step up from the red, a little bit tougher, and then the blue is one of the toughest. Now we don't want to start with these right off the bat, but as we progress, we can bring in the different strengths. Alright, so just to conclude and recap our program, we have the 3 exercises that we will be doing. Each of these exercises will be done 3 sets for 10 repetitions and have a hold of about 5 to 10 seconds, slowly bringing it back in. The 3 exercises that we have are the serratus punches, the external rotation, as well as the band in the door as we are bringing it back in. These exercises will be performed to start every other day. As strength is increased, the patient is able to do them every day, again 3 times a day for 10 reps. We want to make sure that the exercises are progressing so that we are adding in the different loads of bands, but we want to do that in a progressive state where it is no pain in the ranges of motion for the individual. We're stabilizing the shoulder, you're going to grab this,